Do we need to take medical treatments, or can we prevent and cure illness by being healthy and making sensible lifestyle choices?
Okay, well, I mean, there's no doubt that a good, healthy lifestyle, there's a lot of benefit in that, and it can prevent a lot of disease. There are many diseases which are just happen anyway. Obviously, it's Allah's decree. So, despite all your efforts, you can still get that. That's important to remember. But yes, certainly many diseases, if you are healthy, you have a good lifestyle, you avoid unhealthy food, you don't smoke, you don't drink, waliyadu billah, etc., etc., then many things can be prevented. Despite all that, it may still be decreed for someone that they will get an illness. And at this stage, you do need to take treatment. It's harmful not to, essentially. And there's nothing wrong with this. In fact, this is something which is encouraged to take the actual treatment that you need. There's that hadith that Allah did not send down a disease, except that He also sent down its cure. So take medical treatment. That was the statement of the Prophet. So, and we see that we do get new diseases, or some diseases become more common, and therefore we have new treatments which we need to utilize for them. And it's perfectly reasonable to do both together. You take the life, and you see that this is what doctors say. Someone might have a diagnosis like diabetes or a heart attack or something like that. The doctor will say, look, you need to change your lifestyle, you need to do X, Y, Z, and you need to take this medicine, you might even need this procedure, you might need this surgery. And there are levels of treatment depending on how serious your illness is and how much risk there is of harm. And that's why you need that doctor, that expertise, to do the appropriate level of treatment for the appropriate stage. Also, just related to that is we don't need to have this concept that it's natural versus natural lifestyle and that kind of thing versus any other treatment. The two things come together, and they're part of the same concept, that things which work and are of benefit and are proven to be of benefit, then we should utilize them. Okay, and in fact, many drugs or medical treatments, they have actually been derived from natural herbal treatments and so on. So for example, there's a type of chemotherapy, which is a drug to treat cancer, and that had a natural source, I think from something in the sea or something like that. That was then refined and purified and made into a drug. Or aspirin was derived from willow bark and so on. So basically the thing is that we take both together. Lifestyle prevents and can help maybe with the very early stages of the disease, but we do need medical treatments, and it's entirely appropriate. It is entirely appropriate to take the treatment for the disease as you need it.
Okay, so taking medical treatments sometimes becomes necessary, but is it, some people would prefer to avoid taking modern medical treatments in favour of more natural treatment options, because of the fear that modern treatments contain a lot of chemicals which may cause harm to the body and have a lot of side effects, whereas the natural treatments won't have those harmful effects. So they're happy to take the treatments, but they prefer to opt for a natural treatment rather than a modern medical treatment.
Well, I think everything contains chemicals, firstly. So the most natural tomato or vegetables will be full of all sorts of chemicals. They may have small amount of toxins or toxic chemicals as well. Also the amount or the dosage, anything in the wrong amount or wrong dosage can be harmful, whether it's natural or not. We need to recognize that. Take something very natural like tobacco, which is used for cigarettes and cigars or whatever. Hundreds of thousands, if not millions of people have died because of this natural substance. So that simple idea that, okay, natural is okay, modern medical is bad and risky, well, I don't think that's a fair assessment. In terms of when we treat a patient, we are, it's not like we just don't care, let them get side effects, not at all. the first thing that's drilled into someone at medical school is first to do no harm. Okay, so we have to be very careful, and we don't want to harm or cause any harm to the patient, and we only will treat them with a medicine or with surgery or whatever if we weigh up the harm and the benefit, and we know that the benefit far outweighs the harm or the risk of harm. That is when we go ahead and do the treatment. Now, the thing with the medical system, the modern medical system, is that it's very regulated and controlled. So that if we give someone some treatment, it has to be very carefully tested to make sure that there's no or minimal side effects. Okay, and then even when they start giving the treatment on a larger scale, there is still a feedback. So if people do get new side effects or more common side effects, that's actually fed back, and sometimes drugs can be stopped even at a later stage because of that, and that does happen. That's the kind of system we have in place. We also have to be very transparent. So when we talk to the patient, or if you open up a list inside the medicine box, it'll say these are all the side effects, because we have to be open. We have to explain, look, and be transparent. These are the side effects. If you look at natural treatments, there are many things out there, but that market is not regulated at all in the same way. So there's no obligation to test them in the same way. There's no obligation to tell the patient that they're the side effects. So we may simply not know, that people are getting side effects from that. And in fact, sometimes that does happen, that some things which sounds, logically it sounds, oh yeah, that should make sense. It should be, it should be fine. What's the risk? Like, for example, I'll give you an example. There was this idea some years back that if people take high doses of certain vitamins, which are antioxidant vitamins, that will prevent heart attacks and deaths from heart attacks. So then people got very excited. They started taking these vitamins in large doses. And then later, when they started compiling and getting more data, and they actually looked at the data, they found that actually it increased the risk of death or heart attack. So it's not so clear cut and simple as that. So again, that's why we need a good regulated system, and we need that expertise of doctors and people who know how to assess evidence in order to treat people safely and well.